gentlemen, welcome aboard to Feline Airlines. Your cat's well-being is very important to us here at Feline Airlines. Traveling with your cats may be fun, however, it can be stressful for the cats. Due to the recent spike in feline hepatic lipidosis, we would like to brief you regarding this disease. On behalf of the crew, I ask that you please direct your attention to the monitors above as we review this disease. And thank you for choosing Feline Airlines.
One day, Irene noticed her cat Chonky wasn't feeling that well. Irene was really worried, so she brought her cat to the vets for checkup. She was greeted by Dr. Neem. Doctor did ask some questions regarding Chonky. Chonky is a 7-year-old cat. She recently lost her appetite and her weight reduced as well. She recently had diarrhea and her overall condition did decline. Dr. Neem performed physical examination on Chonky to come up with her diagnosis. Based on what she could narrow down to, Chonky could be diagnosed with either a viral infection, diabetes, or feline hepatic lipidosis. But before we can conclude her condition, let's look at the clinical signs.
Ladies and gentlemen, now we will be playing a short game on the clinical signs of hepatic lipidosis. The game rules are: look at the picture and click on the best answer. The game will be all about the clinical signs of hepatic lipidosis. So, know your clinical signs before proceeding to the game. Good luck and all the best.
Are you ready, kids?
When doing a necropsy on a cat that died due to suspected hepatic lipidosis, there are some lesions that we should look out for. The most prominent lesion we can see is on the liver itself, hepatomegaly and jaundice. Hepatic lipidosis occurs when there is rapid and excessive mobilization of fat to the liver more than the liver can metabolize, leading to accumulation of lipids. The excessive accumulation of lipids causes structural changes within the hepatocytes. As lipid droplets increase in size and number, they can disrupt the normal cellular architecture and functions of the liver cells, one of which is the conjugate bilirubin. The accumulation of lipid can lead to the swelling of hepatocytes, causing them to enlarge. As more and more liver cells become engorged with fat, this collectively contributes to the increase in liver size, resulting in hepatomegaly. As the liver functions continue to decline, the ability of the liver to conjugate bilirubin is also impaired, leading to the accumulation of yellow pigments in the liver. A consequence of liver failure is the increased amount of bilirubin in the blood, which is termed hyperbilirubinemia. These pigments are then deposited in several tissues of the body.
If we view the liver cells under the microscope, it would look something like this. Instead of the usual liver, which looks like this. See the spherical white spots? Those are fat lobules deposited in the liver. Due to your cat's reluctance to eat, fats from all parts of the body have mobilized to the liver. This is why the cat loses weight in such cases. These white spots are fat lobules that have deposited in the liver, and this affects the daily function of the liver, such as detoxification of drugs, bile production, and metabolism of nutrients.
The leaflet on the pathogenesis of feline hepatic lipidosis can be found in the seat pocket in front of you. Please read through it carefully. Firstly, the cat undergoes feed deprivation, possibly due to mouth lesions causing pain. Then, starvation occurs due to malnutrition. The low glucose level causes a low energy level, leading to the breakdown of body fat storage sites, which can be seen as serious atrophy of fat. Lipolysis releases free fatty acids and glycerols that are transported to the liver for metabolism through the bloodstream, whereby the FFA oxidizes and releases into the plasma as triglyceride-rich, very low-density lipoprotein. It is used as an alternative energy supply to cells. However, as starvation prolongs and lipolysis continues, the bloodstreams become filled with fatty acids, which then overwhelms the hepatocytes in the liver, causing hepatic fatty degeneration, also known as hepatic lipidosis. This greatly affects the hepatic efficiency. Over time, the fat storage depletes. The body then uses energy supply from the muscle protein catabolism, whereby amino acids are released into the blood, transported into the liver to be converted into glucose through gluconeogenesis. Then, skeletal muscle atrophy occurs, causing the cat to be emaciated.
How can you diagnose hepatic lipidosis? Firstly, we can do blood tests. There are 3 sites for venipuncture, which are jugular vein, cephalic vein, and femoral vein. The blood will be sent to the laboratory for inspection. As a result, there will be elevation in alkaline phosphate (ALP), bile acid, and bilirubin, or known as hyperbilirubinemia. If there is an elevation in bilirubin, there is no need to test for bile acid. Secondly, we can do liver biopsy by inserting a needle into the liver through the skin guided by ultrasound. As a result, there will be profound lipid vascular distension involving more than 80% of aspirated hepatocyte. Third, we can do fecal examination. This is to differentiate between hepatobiliary fluke infection that may masquerade as hepatic lipidosis. Fourth, radiograph. We can see that the liver is enlarged, showing sign of hepatic parenchymal hyperechogenicity and hepatomegaly.
Feline hepatic lipidosis is a critical liver disorder frequently initiated by prolonged anorexia in cats. To safeguard your feline companions, prioritize obesity management, reduce stress, and ensure they receive proper nutrition. Always consult with your veterinarian for personalized advice and care crafted to meet your pet's unique needs. Stay informed about feline hepatic lipidosis and proactively take necessary precautions for the well-being of your beloved furry friends. Their health and happiness are in your caring hands. With that, thank you for choosing Feline Airlines.
Iya, Kat. Kat dah habis.
Habis?